North West Ambulance Trust were approached by NHS Digital and NHS England at the beginning of March 2020 to trial video consultation within a 111 setting. We use the Good Sam product Instant On Scene with 9 of our clinicians who integrated video consultation into the clinical decision making process with their patients calling 111. And here's what they thought.
Oh, hello, is that Sarah? Hi, my name's Kieran, I'm one of the nurses from 111. So, I believe you've got a bit of a rash on your hand there, Sarah, is that right? Do you want to just give me some explanation of the symptoms that you've got as well? How long's that rash been there for? As clinicians, we rely on quite a lot from what we see, not just for what we hear. So when you bring clinicians into an environment such as telephone triage and you remove that sight element, you're often not able to make as good enough and an effective clinical decision as you would be if you could see your patient. Using something like telephone conferencing brings that visual element back, so we're able to make a more well-rounded clinical decision based on your experience and your knowledge, really. So it would help me quite a lot if I could have a bit of a look at this rash, if that's all right, Sarah. Do you have a camera phone? Okay, and do you have enough data, or do you have any Wi-Fi there for a video call? Fantastic, all right. So what I'll do is I'll send across a text message, okay? I'll send it off to this number that we've got on file for you here. All right, sends through a link. So if you just click on the link, it may ask for some permissions as well. If you just accept them, I'll be able to have a bit of a look at this rash, and we'll make sure we get the most appropriate level of care there for you. So just bear with us a moment just while I send this across to you. Yes, I can see that. That's fantastic. Let me just get a bit of a better look there for us. Fantastic. Okay, so just running through here. Okay, so we have got the rash there. Okay, there's no blisters or anything from what I can see there. The rash doesn't appear to look like any blood spots or bruises underneath the skin at all. Okay, no new or worsening confusion at all either. If you just twist your hand round for me there, I'll have a bit of a look at the outside aspect of your hand there. That's absolutely fine. We've not got a large area of skin that looks like it's been scalded all over. Okay. We said that initially that the rash was more generalised, or it's affected more than one area of your skin. Okay. I'll just change that there. It is just on your hand from what I can see. All right. So let's have a bit of a look there for you. All right. And it's not just on one small spot or mark, as we've said there. It's not sore and inflamed. Okay. Not felt hot or feverish in the last 12 hours at all? Okay. Good, excellent, okay. And you've not already seen a doctor on this occasion, I believe? And no diagnosis of any other skin conditions we've said as well. Okay, so I'm satisfied from what you've told me, Sarah, and from what I've seen, okay. We are safe to manage your symptoms at home, so I'll give you some further advice in terms of how we'll go about doing that. One case that comes into mind in particular when video consultations helped is a case that I'd picked up where a child had sustained a burn. The burn was actually significantly worse than how it was described to the health advisor on the initial call. So when I've been able to contact the caller and I've spoken to them and I've been able to see the injury myself, it's actually been significantly worse. And the size of it, which was initially described as being smaller than a palm print in size, was based on the mother's palm print rather than the child's. So we've gone from a home management disposition initially to an emergency department disposition. Any new symptoms, condition gets worse, changes, any other concerns, just do give us a call back on 111, okay? Have you got any questions for me at all? Fantastic. So what I'll do is I'll close this video down for you here, okay? Doesn't download anything onto your phone, so there'll be no trace or anything of it on there as well. The video isn't recorded either, so there's no records of the video either. All right. All right. Have a lovely day. Okay. Take care. Bye bye.
I found it to be really good. It's brilliant, in fact. It's really helped me as a clinician to get a real in-depth assessment of my patients. As a clinician, you do like to see your patients, and this has helped in assessing patients with rashes, elderly patients, and it's made the clinical decision making a lot easier for us. I've used it in particular with one patient, an elderly lady in a care home. She'd fallen, she'd got a gash to her head, The care home rang really distressed. There was a lot of blood and they were panicking a little bit about the patient. The brilliant thing was I was able to see the patient, see the amount of blood and the actual size of the laceration. And the wonderful thing was we were able to keep that lady with dementia in a home environment. We just had to do home management.